Good afternoon. My name is Lisa Fleming, and my presentation is on interprofessional communication and the importance in healthcare and how it leads to positive patient outcomes. Interprofessional communication is a collaboration that occurs when healthcare providers work together, when they work with people from within their own profession, people outside their profession, and most importantly, with patients and their families. In order for this type of communication to be successful, it must be conducted in an open, collaborative, and responsible manner. And one of the most important characteristics of interprofessional communication is that it occurs in an environment of mutual respect. Interprofessional communication between healthcare providers and disciplines is of extreme importance. When professionals harness the skills needed to promote interprofessional communication, it leads to improvements in patient quality, safety, and it leads to better outcomes for our patients. This type of communication builds trust amongst people, their families, and team members. An environment of mutual respect is essential for interprofessional communication, and respect helps facilitate a positive environment in which to set shared goals, create collaborative plans, make decisions, and share responsibilities about our patients' care. The evidence shows that when inconsistent verbal communication exists between providers and nurses, there's an increased risk for potential error, harm, or even hospital readmission. The literature also suggests that the lack of shared dialogue about the clinical plan of care creates the potential for medical, surgical, medication, and diagnosis errors, resulting in poor quality care. Multiple studies have concluded that communication and care coordination between care providers is essential to better outcomes for our patients. The research shows that implementing systems to facilitate team communication can substantially improve quality, and healthcare workers have described improved teamwork and communication are among the most important aspects in improving clinical efficacy and job satisfaction. The master's prepared nurse can play a vital role in eliminating the multiple barriers to effective interprofessional communication. And this begins with identification of the existing barriers, the development of core competencies for caregivers, education of interprofessional communication, development of policies or standards of care surrounding common language for caregivers, and also implementing established communication tools to enhance effective team communication. It's been reported that a reduction in the use of medical jargon is effective in strengthening interprofessional communication and thus decreasing adverse patient events. The quality of patient care is improved when members of the healthcare team work collaboratively to share their expert patient care perspectives. The nurse leader is in a unique position to assist in the efforts mentioned to increase communication between caregivers. When caregivers communicate and collaborate effectively, it generates trust, respect, shared accountability, and decision-making, and effective teamwork, which all leads to improved patient care. As you can see in this pictorial graphic, that the objective of the evidence-based project that I am proposing is to improve the quality of patient care and patient satisfaction, along with reducing post-procedure recovery events related to sedation and anesthesia. The proposed environmental change will provide patients with a noise-reduced therapeutic environment that promotes healing and rest. This project employs the implementation of proven noise reduction strategies, and these are aimed at successfully meeting the project's objectives and outcomes. The members of the interprofessional team, essential to the success of this project, will include the key stakeholders, and those include the nurse manager, the assistant nurse manager, and they will provide information about project goals and objectives. Other stakeholders include members of the unit council, who will assist in presenting the project goals and objectives to the staff. And they will be a major resource for questions, concerns, or issues that arise with project implementation or when optimization needs occur. The nurse educator will play a role in assisting in the development of a didactic presentation, and the nurse-patient simulated scenarios will add to that. The nurse educator will partner with the Department of Organizational Learning to provide a video for the education presentation and simulated scenarios for staff. The Standards and Policy Committee nurse representative will help to develop the unit noise policy, and this policy will clearly identify sources of noise and outline acceptable decibel levels in a procedural setting. The noise policy will also outline appropriate background music and proper communication and conversation in patient care areas. This interprofessional team will be instrumental in the implementation and sustainability of the proposed project. Nursing will play a major role in this project proposal. Nursing will guide, direct, and provide the greatest impact for this project. The project is centered around the nursing theoretical framework of Kolkaba's theory of comfort. This theory can be applied to nursing practice, education, research, and it provides the focus of meeting patient comfort needs. Those involved in project development, implementation, execution, and education for staff includes nurses at all levels, ranging from leadership to those on the front line of care. Nursing involvement and engagement adds significant value to the project. Nurses are in tune to the physical and psychological needs of their patients. They are also a driving force for team collaboration. Nurses are excellent coordinators who are able to interact effectively in intellectually diverse populations of physicians, technologists, administrators, patients, and family members. This ability to communicate with individuals from diverse backgrounds and who have different goals and responsibilities is a remarkable value within today's complex healthcare environment. Here's another pictorial outlining the collaborative strategies that will be employed for the project proposal. Multiple strategies will be utilized for the project design, coordination, and evaluation. Project design will consist of collaborative strategies to include meetings with nursing leadership, physician leadership, and members of the unit's quality improvement team. Project design will help describe the project and create a sense of urgency for the project proposal. Meetings will allow for open discussion, idea sharing, and opportunities for questions to be posed about the project and how it will be implemented. It will also be necessary to meet and collaborate with members of the organization's quality department who are able to extract data from patient satisfaction surveys. Project coordination. Collaborative strategies will include the assembly of a coalition of enthusiastic, knowledgeable, and trustworthy members of the team. These stakeholders include nurses, technicians, schedulers, providers, and most importantly, the informal leaders amongst the staff. Engagement from this group of individuals will be necessary to help lead the change, especially with unit laggards. Effective collaboration strategies will include meetings, huddles, informal conversations with all members of the team. Other collaborative efforts will be to involve the unit educator and a member of the Department of Organizational Learning. This team will be instrumental in helping to coordinate educational activities for the staff. Project evaluation. Well, data will be collected from patient satisfaction surveys, post-procedure phone call surveys, and data from the sound meter that will be collecting decibel levels. Communication about project status as well as outcomes will flow to all staff via staff meetings, huddles, email, and the unit communication boards. The coalition and unit leaders will continue to check in with staff regularly for questions or concerns, as well as to deliver information updates. All members of the team will hold each other accountable for engaging in the expected behaviors surrounding the change. These efforts will increase the sustainability of the culture change and the project proposal. Communication strategy that will be utilized to develop, participate, and lead the project will include daily team huddles, weekly staff meetings, and they will all be used to help define the project's need and implementation. These informal settings will allow for open dialogue, questions, and feedback. Information sharing will take place at the team's quarterly meetings, which are attended by all staff and providers. This forum is used to discuss unit performance improvement initiatives, regulatory requirements, and communication and team building initiatives. This is the perfect setting to discuss and inform about the project proposal. A unit noise policy will be developed to guide expected behaviors associated with the clinical change. This communication strategy will be one of the key interventions to increase sustainability of the project. Another communication strategy that will be employed will be the development of an education poster for all team members to view, as well as a means to remind them of the purpose of the project and expected outcomes and goals. Educational sessions will be provided to assist staff members in engaging in the evidence-based change. Education will include didactic, video, and role-playing sessions. Communication strategies used to educate team members will allow for open dialogue between staff, questions, feedback, and the offering of suggestions. So in summary, interprofessional communication is necessary in today's fast-paced and ever-changing healthcare environment. When interprofessional communication takes place, it provides an atmosphere of mutual respect, which then translates into a positive and collaborative environment for all. Effective communication between professionals has a positive impact on patient safety and patient outcomes. The nurse leader has the skill and ability to facilitate effective interprofessional communication between all members of the care team and can be the driving force for team collaboration. Nurses are excellent coordinators who are able to interact effectively with providers, patients, and family members. This ability of the nurse leader is the key to successful patient outcomes. Strategies to enhance teamwork and communication can be successfully implemented in the acute care settings. They result in more efficient and effective communication. Because ineffective communication among the healthcare team members contributes to patient harm and adverse events, interventions and implementation methods become instrumental in preventing negative patient outcomes. When team members rely on one another, teach each other, and have the opportunity to practice in a highly successful environment, this usually brings great individual and team satisfaction. When they feel a common purpose, they inspire and motivate one another. The bottom line for this is interprofessional communication and teamwork is the groundwork of keeping patients safe and provides for patient positive outcomes. I would wager to say that the number one reason care providers were drawn to a career in this field is to keep patients safe and to care for patients. When healthcare providers collaborate and communicate, it's a win-win for all.